Okay, moving on. Got a lot of questions coming in. What type of progress research is being made for patients that have become platinum resistant?
So, Amy, maybe you want to talk about that a little bit?
Well, I guess there's been, some different combinations of treatment that they are looking at, kind of combining your typical single-agent chemotherapies with other drugs to see if adding the combination will make them more effective, than on their own. We are using PARP inhibitors in combination also with different types of drugs to see if that will benefit people even without BRCA mutations. And I'm trying to think of what else has been happening.
I will say that we tend to, since platinum resistant is sort of our toughest population of patients, that's kind of the acid test for new therapies, and lots of times the first thing we will do is test a new therapy in the platinum resistant population, and then if we get a hint of activity, then we will move it up into the platinum sensitive population. With take Doxil, for example. Doxil was initially tested and compared to topotecan in platinum-resistant patients. It showed some benefit. It was then looked at in a phase one studies in combination with carboplatin, and then it was looked at carboplatin and Doxil was looked at in combination compared to Taxol carboplatin in recurrent platinum-sensitive disease. And then most recently, it's been looked at in with initial therapy. So it moves up from the platinum resistant is kind of where we start most of our testing, and then we move it up. It's true for the PARP inhibitors as well. They were initially tested in recurrent platinum resistant refractory and some platinum sensitive patients, but then moved up into the maintenance setting after initial and second line platinum based therapies.